Welcome to Common Sense Care, parenting your gender-confused child with truth and love. Brought to you by Partners for Ethical Care. So-called affirmative care is the gender industry's one-size-fits-all response for every person who struggles with their identity. In no other area of medicine, psychology, or education is one treatment plan assigned to every person. At Partners for Ethical Care, we believe that each person is an individual and should be given the care and treatment that's most appropriate for him or her. Welcome back. I'm Maria Keffler.
I'm Erin Brewer. And what's our topic today, Maria?
Our topic today is problems with medicalizing children. We're going to talk about, think about what really happens when you start to chemically or surgically alter a child.
And this is such an important topic because one of the things that the trans activists say over and over and over again is that being transgender is a normal developmental path, that this is all just normal. It's just as normal as someone who doesn't have gender dysphoria, that anybody who questions this normal developmental path is just transphobic. And the reason that this is so dangerous is because it isn't a normal developmental path, because it becomes a medicalized path where a child who is normally developing becomes medicalized in ways that affect them for the rest of their lives. That's not normal. Normal is when you do not have to do interventions in order to prevent normal development.
Yeah, is there any other normal or any normal developmental path that requires surgery at some point or requires
any or medical medicines or these drugs that are so harsh? I mean, if it's normal, then it doesn't require interventions. We usually require interventions when there's some kind of a disease or disability, but not when something's normal. So they're trying to basically say that giving a child incredibly harsh drugs is normal.
I think we need to start off by pointing out why this is happening.
Mm-hmm.
The reason why this is happening is because it's a billion-dollar industry. If they can get children, and by they, I mean the gender industry, the gender doctors, the pharmaceutical companies, if they can get children on a path of medicalization, they're on that for the rest of their lives. And this is a billion-dollar industry. Recently, I came across a market report by Global Market Insights, I believe was the name of the company. They do research into market trends and then write comprehensive reports that companies can purchase to figure out the best strategies to leverage a new market trend to make money off of it. And they did this market report on sex reassignment surgery. And I only saw just the introduction because you have to pay several $1,000s to get the full report. But the introduction summarized that this is a growth market and they expect this to make billions of dollars over the next few years. Well, if it is normal for kids to be transgender, then there's some finite number of people for whom that is normal. Historically, it's been 0.7%. So 7 out of every 1,000 people struggles with their gender identity historically. If that is the case, it cannot be a growth market to do sex reassignment surgeries, because a growth market means that it continues to grow. It's not a finite number of people. And the only way you grow a market is by cultivating new customers for it, by selling it, by marketing it. And that's exactly what we're seeing here. And so that is why this is happening.
And I think there's a strong motivation among big pharma to cultivate this. And we see this in, there are pharmaceutical companies who are providing grants to schools to hire school counselors. They're going in and giving programs to schools to talk about gender identity. They're actively cultivating a clientele. And one of the things that I look at is the evolution of the drugs that are being used. And one of the drugs, Lupron, which is a puberty blocker, which is just an incredibly harsh drug, was originally used to chemically castrate sex offenders, and it was deemed to have too many negative side effects. And so it was a cruel and unusual punishment to use on sex offenders. So then they started using it to treat endometriosis and other disorders. And women started having incredibly bad side effects. There's actually a movement now among women who took this for endometriosis and other issues to have it banned because the side effects are so profound. So as this is happening, the pharmaceutical companies trying to find another clientele they can push this on because they've got this drug, they want to make money. The same thing with testosterone. For a while, pharmaceutical companies were really pushing testosterone as sort of a health aid for older men whose testosterone levels were dropping. Well, they found it had huge side effects. A lot of men came together and filed a class action lawsuit and won because testosterone, as it turns out, is not even a good additive for adult males. So if we're giving it
Whose bodies are accustomed to
who's right,
testosterone.
exactly, who are used to it. And so what I see here is this pharmaceutical companies wanting to find another market, and boy, have they ever. And so to me, this is it's so insidious that people are making money off of children and children's mental health and causing them to be medicalized for the rest of their lives, because as it turns out, the pharmaceutical companies have a great plan here, because even if a child decides, gosh, I made a mistake, I'm not actually transgender, the likelihood is that they're going to be medicalized for the rest of their lives because their bodies will have stopped creating the normal hormones that they need. So those children, as they move into adulthood, are going to have to take hormonal supplements for the rest of their lives. This is a lifelong client these pharmaceutical companies get at, starting around age 8.
I think people have this idea that pharmaceutical companies, well, I think there's a lot of people who have very different ideas about pharmaceutical companies, either very bad or very good. But I think people who really think the pharmaceutical companies are their friend have this impression of them as they're, trying to make drugs to improve people's health and improve people's lives.
Yeah.
But ever since we started allowing advertisements for pharmaceuticals, I think the pharmaceutical companies have taken a very different path.
Mhm.
And it's now about making money, it's now about marketing. When my youngest daughter was just a baby, I was going to the pediatrician and I had her, I was holding her, and I got in the elevator, and this man stepped in the elevator with me. And I almost could not stop staring at this man. He was the best looking man I had ever seen in real life. Now, I love my husband, he's a handsome man. This guy was on a whole other level, like Hollywood level. And and my daughter, a baby, was looking at him. Anyway, we both go into the same office, and he goes back into the doctor's office. And I leaned over to the receptionist, the nurse there. I'm like, okay, I'm happily married, but who is that? And she said, oh, that's the drug rep. We love when he comes.
Oh, wow.
And I saw a documentary about pharmaceutical companies hire these incredibly attractive men and women as drug reps
Wow.
who go in and foster relationships with doctors. Um,
Well, and
why?
that's the other thing that I hear over and over and over again is let doctors do their jobs. Doctors know what they're doing. Doctors would never do something that's harmful. And this is on the heels of the opioid epidemic. And so I'm like, how is it that we so quickly forgot that doctors were handing out opioids like candy and caused death and destruction throughout the country?
Yeah.
And now we have people saying, oh, they would never do anything that would hurt children. I'm like, well, how can you even say that? And we know that, like you said, these drug reps go in and push it. There's hospitals are getting huge endowments from pharmaceutical companies. And one of the Jennifer Pritzker, I believe, she has like a whole so even I do
Yeah.
it. Jennifer Pritzker is a trans-identified male who has this huge family fortune, goes around giving it to gender clinics and providing them with funds and again, resources to go into the schools to recruit more. So of course, this is about money. And if it were simply that they were encouraging children to question their gender identity and that was it, I would still be upset with it, but it wouldn't be so horrifying as the fact that these children, once they start questioning, are so quickly encouraged to get on puberty blockers, cross-sex hormones, do surgeries. And I even saw a blog post by a parent whose 11-year-old child um, said that they were transgender a week ago, and the mother was already pursuing puberty blockers after the child saying this 1 week. So these parents are being actively encouraged. Once a child in a peer group comes out as transgender, a lot of other kids start coming out as transgender. If you have parents who are embracing this ideology, there's a lot of pressure on parents to start medicating their kids. And I just want to talk about some of the negative side effects of these drugs. These are not benign drugs. I hear over and over and over again, it's simply a pause. We're just putting a pause button, giving them some time to think. That's a lie. That's just a blatant lie. They cause bone demineralization. They induce a developmental delay. Maria, can you think of any other situation where a parent would consent to a child being induced a developmental delay where they would celebrate that their child is being developmentally delayed artificially?
These blockers, these puberty blockers, stop brain development or slow brain development. And I'm thinking of a show that I just watched. I'm trying to think of the name of it. It's a doctor who she writes for the New York Times, I believe. And she takes on these really difficult medical cases that they can't find what's causing the problem. And she crowdsources it. She writes an article for the Times. It goes all over the world. And then all these doctors and researchers and so forth write in and they try to figure out what is this rare disease. Well, she had this case of this young girl. I believe the problem started when the girl was about 6, and I think she's about 11 now, of having seizures. And she was having more and more and more rapid seizures. And they're pretty sure that it's a brain issue. And the resolution is to cut the two halves of the brain
Mhm.
separate from each other, kind of like they will occasionally do for really bad epilepsy. The parents are agonizing over this because they're not 100% sure this is what it is.
Mhm.
They think it is, but if they do this, their daughter will be mentally handicapped. If they don't do it, she will die in the next few years. And I don't remember the resolution. I think at the end of the story, the parents were still trying to wrestle with whether they wanted to do this or not. We know that Lupron and puberty blockers cause developmental delays.
Yeah.
And we know that up to 90% of children who express gender dysphoria, if allowed to pass through puberty naturally, will resolve and accept their birth sex. Even the World Professional Association on Transgender Health says that in their standards of care. If 90% of kids are going to resolve this if they go through puberty naturally, why would you not let them go through puberty naturally?
Right. And even for those who aren't going to have it resolved, why would you induce a developmental delay? Why would you cause them to have significant side effects? Some of the stories from women who use Lupron for endometriosis are heartbreaking. They're wheelchair bound in pain for the rest of their lives. This is a serious drug. Another concern that I've seen being raised more and more often is that these children are going to have to be put on growth hormones because Lupron causes it blocks development, including growth. And so these children who are being put on these puberty blockers are actually having their growth stunted. And so, especially for the girls who are identifying as boys, now doctors are starting to push putting them on growth hormones. So we've got this cocktail of incredibly powerful drugs that we're, putting children on. Puberty blockers, potentially growth hormones, and then cross-sex hormones, all before the age of consent, all before they're really old enough to even understand the implications.
And who benefits?
And
The
who?
drug companies benefit.
Mhm.
How convenient. Oh, the drug that we gave you stunted your growth. We've got another drug that'll help that. How convenient.
And then if you happen to be depressed because you didn't get the results you were hoping for, don't worry, we've got a drug for that too. I mean, it just, to me, it's so insidious. And the fact that we would be doing this to children, we didn't even talk about some of the long-term effects of the combination of the puberty blockers and cross-sex hormones, which is infertility, lifelong infertility. Their gonads never develop. There's some thought that this combination of drugs will also inhibit sexual development. They'll never be able to grow up and have an orgasm. I mean, these are things that kids don't even think about. They don't even, orgasm, ideally, they don't even know about. But we're impacting their health for life. And why? Why are we doing this? If gender dysphoria is a normal developmental path, why don't we let them proceed down that path normally without medicalizing them?
Mhm. And I want to know, is gender fixed or is it fluid? This
Well,
is sort of a
it
side
depends on
issue.
which side you're on. Apparently, it's fluid if you're moving towards transgenderism, but not if you're going the other way around.
Well, and my question is, if it's fluid and it can change at any point in your life, why would you ever medicalize that?
Yeah,
Because what you medicalize toward today could be the opposite of what you want to be 2 years from now. And if it's fixed, if gender's fixed, we need to know, when is it fixed? Is it fixed
right.
at birth? Is it fixed when
Yeah.
you're 10? Is it fixed when you're 40? Then you should never medicalize outside of that fixed time
Well, and
period.
we can't determine that because we have people who change their identity from the age of now 2 until 80s. We have people coming out and saying, I'm transgender. Any point along that, we have 2-year-olds whose parents claim they're transgender. And we also have detransitioners who say, I really thought I was transgender, but it turns out I made a mistake. This whole thing is an experiment. It's a medical experiment. There is no diagnostic test or standard for transgenderism. So we're medicating kids without even having a diagnostic criteria for medication other than the child saying that they feel like they were born in the wrong body. Now, in what other case, again, do we give a child medication based solely on the child's self-report of some kind of metaphysical problem, disconnect between their brain and their body? This is such a huge concern that children are just walking in, and often they're coached by their peers. They're coached by their peers to go in and say this, this, and this. And we know this because we see it happening on social media. And so to me, it's incredibly concerning. And I'm so thankful that there are doctors like Patrick Lappert and Michael Laidlaw who are bringing this up because it's a huge question mark. Like how on earth are we justifying this? And again, it all comes down to big pharma.
The FDA's database currently lists more than 25,000 adverse events associated with Lupron, including suicidal thoughts, vision loss, and excruciating pain, even deaths. I started investigating Lupron in 2009.
Right now, my face is numb, my shoulders are numb, I feel dizzy. I just don't ever feel good.
It's debilitating. I can't work full-time. I suffer quite a bit.
Several patients have sued Lupron's maker, Takeda Abbott Pharmaceuticals, now known as AbbVie, and the FDA did require several changes to add more side effects to Lupron's label. But many say that is not enough.
It's really sad, I think, that it's still on the market.
How about this? How about for the so-called transgender child, the gender identity? Can you find it in a blood test? Can you do testings of genetics? Or can you do a brain image and find the gender identity in there? You cannot. There is no objective test to diagnose this. Yet we're giving very harmful therapies on the basis of no objective diagnosis. What governs this whole system is the endocrine system. There's a small gland that's at the top there called the pituitary gland, hangs off the brain, produces hormones, signaling hormones. You can see LH, FSH. These act on the gonads. So in the male, LH will act on the testicle to produce testosterone, you can see illustrated there. And in the female, LH will act on the ovaries to make estrogen. And it's these hormones which take the person through the stages of development and then are available in adulthood. Now, there are medical conditions where this process is interrupted. We call it hypogonadotropic hypogonadism. This is something an endocrinologist would diagnose and treat. There are also hormones which can cause this to happen. Medications like Lupron, you may have heard of. This is used for prostate cancer. It works in this way to stop the pituitary from making this LH and lowering testosterone and preventing growth and spread of prostate cancer. It's also used in early puberty. There's something called precocious puberty. This might start at, say, at age 4. And so doctors can use this type of medication to delay it to a more appropriate age, like age 10. What about using this medication for stopping normal puberty, say at 12 or 8? This is an off-label, untested, experimental use. It hasn't been through any FDA approval process. It's what I would call a chemical conversion therapy. You can see here illustrated our endocrine society is recommending for these kids to stop puberty at Tanner stage 2, which is just the very beginnings of puberty. And you can see they will not proceed through the other steps of puberty. This is what leads to infertility because they don't establish fertility. Other problems of sexual dysfunction. On the I Am Jazz show, Jazz says, I don't have any sexual sensation. I don't have any orgasm. This is because puberty was stopped at this stage and never allowed to go forward. More side effects, I went through some of them. You're going to disrupt the normal brain development that's happening with the sex-based hormones. It actually disrupts normal bone development because the sex hormones are important, so osteoporosis is a future risk. There are also neuropsychological effects. You can go yourself and look up the side effects of, say, Lupron. You'll see emotional lability, nervousness, anxiety, delusions. It even says monitor for development of worsening of psychiatric symptoms. Used with cautions in patients with a history of psychiatric illness. I've already said many of these adolescents have neuropsychiatric conditions. Professor Michael Biggs at Oxford, through Freedom of Information Act, found out what was going on in their Tavistock clinic. Children actually reported greater self-harm with this medication. Girls exhibited more behavioral and emotional problems, greater dissatisfaction with their bodies. Now you would think, if you had these side effects of these medications, wouldn't you want to stop? Well, eventually they do stop, but they found that the limited studies they have, 100% end up going on, up to 100% going on to cross-sex hormones, which is the next. So cross-sex hormones or opposite-sex hormones, which are really wrong-sex hormones, will be the next stage. So if a female would be given testosterone, just to give you an idea how high these doses are, normal adult female will have a certain amount of testosterone, say in the range of 10 to 50. Medical conditions can bring this up to 150. Tumors may make this as high as 1,000. They're recommending to get these levels in the 300 to 1,000 range. This is some 10 to 40 times higher than the normal range. And are there side effects from this? Of course there are. Both sexes have shown increased risk of myocardial infarction, death due to cardiovascular disease. That's males taking this estrogen, females taking testosterone. With the male, 5 times increased risk of deadly blood clots, 2 times increased risk of stroke. Females also been shown with liver dysfunction, hypertension, potential for cancer of the ovaries or breast. I want to make this clear. There's no FDA approval for either of these medications for this use. And even at the UCSF pediatric site, it explains there, that's highlighted, that there is no FDA approval for this, but they're looking to get it through doing experiments.
Oh, that is just heartbreaking. I know at the beginning of the video, the women who took Lupron and suffered from it. I think about, this again is a little bit tangential, but some years ago, I went to a dentist I'd never been to before. And I had never really had a cavity. And suddenly she said I had cavities in all of my lower molars. And I didn't go for a second opinion. I should have. I just let her drill them. I've had nothing but problems with those teeth since then. I've now had root canals and crowns on a couple of them. And I look back and I have no proof of this, but I wonder if she was just making money off of me because I had never had a cavity. I had really good teeth.
Yeah.
I was so distraught at what I had done. Like, I've ruined my teeth. Why did I make this bad decision? And it really bothered me for a long time. And now I'm seeing these detransitioners who are asking the question, why didn't anybody stop me? Why did this happen? And it's just heartbreaking. And these poor women who trusted their doctors. Oh, Lupron's what you need for your endometriosis.
Yeah, I mean, and that's where, again, this really bothers me when the pharmaceutical companies are basically throwing our confidence in healthcare under the bus. And that becomes really concerning because, like you said, it starts making you question, like, well, if they're doing this with transgender health, what else are they doing it with? Where else do we need to be suspicious? And there's this whole idea that doctors are just in it to help people. They would never do anything. They take the Hippocratic Oath, first do no harm. So we would never have doctors doing these things. And I think ideally that would be lovely. We all want to have confidence and faith in our doctors. We want to believe that they only have our best interests at heart. But we know there are doctors out there that are not acting ethically. We know this. We see it. And yet we're able to put on those blinders. We've had to enact legislation in order to kind of guide doctors because we know that they can go off the rails and do things that are dangerous and unhealthy for their patients. And so it's not unprecedented for legislation to be passed to provide safety for patients. And yet when we talk about banning these highly experimental interventions on children, people get up in arms and say, you can't tell doctors what to do. Well, we can, and we need to, because they're human. And in this case, I really think that they're being influenced by big pharma and also by this whole cult ideology. They're not thinking clearly. They're not examining this ideology at all. And a lot of them, I think, are afraid of being taken down because
Well, I was gonna say too, I think there are a lot of ethical doctors who are concerned about this, but they're being pressured so much to conform and do what they're told. And I mean, we know people who've lost their jobs because they pushed back on this ideology, they pushed back on this activism. And I think I've mentioned before, my husband's aunt works very high up in in the healthcare field and insurance. And I asked her one time about someone I know who is addicted to a prescription drug. And I said, how does this person keep getting this prescription drug? And my husband's aunt said, oh, Maria, you can get anything you want from a doctor. You go in, you just are very firm. I want this. I want this. I know the risks. Give it to me. So that sometimes they'll give it to you just to get you out of their office. They're in a hurry.
Well, and actually, I interviewed a doctor who works at a gender clinic for children, and that's basically what he said. The customer's always right.
Yeah.
And it's like we're suggesting that, it used to be that doctors were in important positions where they were the ones who meted out drugs in a very responsible way. And that's just not happening at all now. It's like if you can even probably Google, like, if I want this drug, what do I say? And I'll probably get it. Which is, it's concerning to me. I mean, but these are children. And I feel like we have a moral imperative to protect children. And even if a parent says their children wants it, that, we don't give kids heroin just because it's going to make them happy. We don't let them drive at the age of 12 just because they want to. We don't allow them to, book a hotel and get some alcohol in and hire some prostitutes. We don't do that. We know that children make that their brains aren't fully developed, that they're not capable of making long-term decisions in their best interests. And that's why we have parents, and that's why we protect them.
There are a lot of adults who don't necessarily make good decisions in their own long-term interest.
Yeah.
I think we all are guilty of making poor decisions. I think about some of the decisions I've made in my adult life that were just ill-informed. I decided something and I just didn't really have good information.
Yeah.
And why are we saying that children can make good decisions when we don't always make good decisions.
Right. Well, it's I spoke with my friend Burley last week, and he started on testosterone suppressors as an estrogen, and then pretty quickly had, testicles, penis removed, penile inversion, brow shave, Adam's apple shave. He continued on and had rhinoplasty and another brow shave. I mean, he had a ton of surgeries because he was told this was the only way he was going to resolve the dysphoria that he had. He didn't really have therapists to help examine the underlying causes. Well, 7 years down the line, he's just as depressed, having just as many problems, only now he's got debt from the surgeries and his body has significant issues. I mean, he has no genitalia anymore. He cannot orgasm. He has no sex life. He's got to take testosterone every day for the rest of his life. He's medicalized now. And nobody ever helped him to identify the fact that he was a skinny, shy kid who was bullied. He was sexually assaulted. He had a speech impediment. All of these things led him to really want to run away from himself. And rather than investigate any of that, and this is as an adult, they told him his only choice was to go down this path. Well, how are children going to discern a good choice if adults even struggle?
Yeah. I'd be curious to know how much the pharmaceutical companies have earned.
Oh, I bet it's
Really,
astronomical.
that's heartbreaking.
Yeah, I mean, and will continue to earn. So even if this comes to an end, even if there's a lawsuit, even if the pharmaceuticals have to pay out some money, they're going to keep making money down the road because this whole generation of kids who have done this are going to be having to take some kind of synthetic hormone for the rest of their lives.
That's just heartbreaking.
Yeah.
It's just, and we're so careful, aren't we, about what we eat?
Right.
Now,
We're
nobody
so careful. We make sure that we don't give them a bottle that has BPH or whatever, BPA or whatever. Yeah.
Yeah, and we don't buy milk that came from cows that has growth hormone in it. We want everything organic and natural, and yet we're so sold out to medicalizing things.
It's so confusing because I also think about like all of those additional synthetic hormones going into our ecosystem. I mean, and one thing that just blew me away, I actually there's a mother, a local activist mother whose daughter is being put on this path. And I found it ironic and somewhat shocking that she was advocating not to spay and neuter animals because it was cruel. And there's just such a cognitive disconnect there. I'm like,
while she's spaying and neutering her children.
Right. Yeah. I mean,
because
it's just
what this is. That's what this is. This is spaying and neutering children.
Yeah, this is eugenics against children who have a certain kind of mental health issue. This is no different than any other eugenics movement that has targeted a certain population, trying to eradicate those types of people. Really, to me, it's shocking that people aren't up in arms about this.
Yeah, I think we've been sold this idea that it's not kind to question this. I think anytime you're told you can't question something, you need to go, oh, I'm asking the right question.
Yeah.
Someone told me my question is a problem, then I'm asking the right questions.
Right, exactly. Yeah, when you kick a hornet's nest, you know it. And this is a hornet's nest, and they're trying really hard to guard that nest and make sure that you don't find out what's inside, because this is not about the health of our children. This is not about helping them to be authentic and their valid selves and happy. This is about an industry that is taking advantage of the most vulnerable in our population.
Well, and Partners for Ethical Care just completed a survey of desisters and detransitioners. It's a very small survey, very informal. It was not a research that you would do.
It was probably about as good as the surveys they use to justify what they're doing, though. It was probably
it was better than that.
Better. Yeah. I mean,
but during that, I was monitoring the results as they came in. And I opened up the survey one day and we had 20 new responses. And I was like, oh my gosh, we had 20 new responses. Well, I went through each one and it was very clear it was the same person who had just kept answering the same way. And we had 60 valid responses that I'm confident are valid. And we had about 35 invalid responses. There were those 20 that were all identical and no commentary. And then there were some that people just made crude statements. There were some that they contradicted themselves on the survey. So anyway, we deleted all of the negative one or all of the invalid ones. But my question is, why are the trans rights people so scared of a detransitioner survey that they're going to try to submit all these faulty results? Now I could say, oh, this is just kids being stupid. But last week, after we announced the results of this survey, somebody who's a very prominent trans rights activist posted on Twitter, ha, 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 I submitted 20 invalid responses to this and I messed up all their data. Well, no, you didn't. I deleted all your responses, sir.
Yeah. Wow.
Or whatever you are. But I have to ask, why are you so scared of us asking people who detransitioned about their experience?
Right.
All the survey was, tell us about your experience, tell us what it was like. And when the trans rights activists are so terrified of that they try to mess up the data, and a couple of them actually put that in their submissions, I'm just here to mess up your data.
Oh, wow.
And to announce later and try to denounce it that our data is flawed because they messed it up. You got to be really, really skeptical of what these people are telling you to do with your children.
Yeah. These are people who do not have the best interests of our children at heart. And I do believe that some of the parents have actually bought into this. I do believe, that some parents honestly believe that this is the right thing to do for their children. And it's because they've been so seeped in this ideology that they're buying into it, and they're not asking critical questions, because if you start asking critical questions, you get piled on. And like you said, people lose their jobs, people lose their friends, people can even be threatened. And so anytime you've got an ideology that's based on fear, and we're not allowed to ask questions, and that people are actively trying to discredit any concerns that we have, even though they're very valid concerns, it's something worth questioning.
Yeah, if the trans rights activists were really concerned about children's best interests, they would be really concerned about the detransitioners. They would want to know, why did you detransition?
Right.
What happened? What can we learn from you
Right.
to help kids going forward? They would be concerned about that. And also the pharmaceutical companies and the insurance companies, when a child detransitioned, they would be willing to cover their surgeries to reconstruct. They would be willing to help them. They are not.
No, they're not. And the thing that is astonishing to me is that young children who claim to have gender dysphoria, body dysmorphia, who are having discomfort because of their outward appearance, the trans activists say, we have to swoop in, we have to help them, we have to change their external appearance, or else they're going to kill themselves. But when a detransitioner comes out and says, I'm having a lot of discomfort about the way that these treatments changed my physical appearance, they say, live with it. Just buck up, deal with it. It's not that bad. To me, that's an indication, again, that certain, your feelings are valid if they're going towards this ideology, but they're not valid if they're going away from it.
Yeah. Well, we have a couple of questions from parents that we'd like to address if we can.
Yeah.
My son's therapist says that Lupron puts a pause on puberty to give my daughter more time to decide about her gender identity. What's wrong with giving a child a little extra time?
Doesn't that sound so benign? Like, there's no problem here. We're just going to put them on a pause. It's reversible. Why are people getting so upset about this, Maria?
Well, because as we've already covered, it's not a pause. It's not irreversible. Puberty has a very small, finite window. It's a tiny window of time that you pass through. And when it closes, when you're past it, it doesn't open back up again. You can't go back. You've missed it. And it's very important. It's important psychologically. It's important physically. Everything about puberty is about changing a child into an adult. And if you miss it, it's gone. It's gone.
Yeah, it's really concerning to me that, I call it the Peter Pan drug, because basically what we're doing is we're keeping children as children while their peers are developing into adults. That is not something you can put a pause on. Not only physically is it causing them to become developmentally delayed, mentally delayed, causing damage to their bones, and who knows what else, because we don't have longitudinal studies. But what's happening is as their peers are progressing, they're not. So any discomfort that they feel, anytime, any sense of not fitting in, not being in the right body, is going to be increased as everybody around them is developing and they're not. They're missing out on important opportunities with their peers. And so it's not only, it's physical, emotional, social developmental delay that is being induced, and you can't reverse that.
Yeah, I just happened to think about when you were talking about the delays to their development. My neighbor is an art teacher, and he told me about this kid that he had. He teaches in high school, and he said freshman year, this kid was the shortest, tiniest, scrawniest kid in the class. And my neighbor said, I came back after summer vacation sophomore year. This kid grew like a foot and put on like 30 pounds over the summer. He's like, I didn't even recognize him. And he had this enormous growth spurt. Now that's unusual. You don't usually see that kind of growth spurt. But one of my kids grew an inch in 3 weeks. One of my kids went up 2 shoe sizes in 3 weeks.
Yeah.
So they have these growth spurts. What if that kid had been put on Lupron?
Yeah.
He would never have grown. He would never have attained manhood. We have such a fascination with youth in our culture now. I was listening to the radio the other day. I won't quote the song because the music industry is draconian, but there's a popular song, and it talks about we're not going to get older. We're not going to grow up. We're always going to be young. We're always going to be free. We're always going to be. And I'm listening to this going, well, you're going to grow up whether you like it or not. I mean, you might not mature, but you're going to get older.
Yeah.
Things are going to change.
Yeah.
When did we stop wanting to be mature? When did we stop wanting to be adults? Because when I was a kid, I couldn't wait to grow up. I couldn't wait to be an adult.
Well, there's a whole narrative now about how hard it is to be an adult. And these kids, they start going through puberty and they hear about like, oh, it's so hard. I have to adult I'm going to have to be an adult. It's so different. I read a book about how kids aren't striving to meet the same goals that their peers did generations earlier, like driving. Kids aren't going out and getting their driver's licenses. Kids aren't dating. There's this whole generation that seems afraid to grow up. And that is so sad. And if you have kids who are afraid to grow up, that makes it all the more attractive to go on puberty blockers. They never have to grow up.
Interesting. It made me think many years ago now, my son was 13, so he would have been 8th grade or so. And he said, Mom, I'm just afraid that like I'm not going to be successful in high school. And like I'm not going to be able to do the work. And I'm scared about college and then about eventually, being an adult. And I remember him articulating that. And we talked through it. And I said, well, you're not in high school right now. You're in junior high. And I said, how have you done so far? He's like, well, I get almost all A's and B's. I'm like, okay, so you have been successful in the phase of life that you're in right now. When you get to high school, you'll be older. Why do you think you will not be equally successful? No, if we put you in high school right now, you wouldn't be successful.
Right.
But as and now he's about to graduate as a senior. He's got great, he's done a great job. But I just tried to emphasize that with him. Don't borrow trouble from the future.
Yeah.
No, if you're 13, you're not ready to be a senior in high school. But by the time you're a senior in high school, you're probably going to be ready for it because you've been successful so far in your life.
But not if you've taken puberty blockers, because those block your development. So yeah, I think that we really need to fight against the use of puberty blockers. To me, they're the most evil. All of this, once a child has her breasts removed, she can't ever experience what it's like to have an adult woman's body. She'll never have that experience. And that's really sad. And there are cases, where, maybe there's a pediatric cancer and a child has to have some kind of serious surgery like that. But that again is a disease state. And we do invasive things when there's a disease in order to, stave off that disease. But we don't do these kinds of invasive treatments if it's a normal developmental path.
Well, do we have time for one more question?
Uh-huh.
Okay. My daughter says if she doesn't start T for testosterone, she's going to commit suicide. She's absolutely convinced testosterone will fix her. How do I convince her that that's not going to help?
And this is a real problem because what happens is that peers, one girl in a peer group will get testosterone and the others will see it and want it. And one of the concerns is that initially when a girl starts testosterone, there is a high. This is a steroid. It's actually a controlled substance. And it causes euphoria. It causes this great feeling initially. So basically, if you and I took testosterone, initially we'd feel really good. We'd get some muscle, we'd get a little bounce in our step. We'd feel pretty darn good. But over the long term, it's causing these huge problems, just like other drugs that make us feel really good. We don't tend to encourage our children to take them. So in this, I want to say to parents like this, if the same child came to you and said, I want heroin, I want alcohol. If you don't give it to me, I'm going to kill myself. What would the response be? Would you say, oh my gosh, okay, we don't want you to kill yourself. I'm going to go find a drug dealer and I'll get you what you want. We don't do that because we know it's not in the best interest of the kid. So I think a parent needs to very carefully assess, first of all, is this child genuinely suicidal? And there are lots of resources online for you to, that you can assess that. You can determine, is this a valid threat? Is this child genuinely suicidal? In which case you have to take it seriously. But in case after case and after case, we hear of kids using this suicide threat to get what they want because they've been coached to do it. And we don't capitulate to suicide threats because what that does is it sets a child up to use that as emotional blackmail in the future so that, what happens when they're, 16 and they want to drive your car and you won't let them. If they threaten suicide, are you going to let them? This sets up a pattern of behavior where the child feels like they can manipulate people in a way that's really dangerous.
Well, and that's something that sometimes happens in intimate relationships. I've mentioned this before. When I was 19, I had a boyfriend who I broke up with, and he just kept stringing me along with, I'm going to kill myself if we're not together. I'm going to kill myself if we're not together. That's not a healthy coping strategy. That's not something anyone should do to someone else. And so, yeah, I want to echo what you said. When a child does express suicide, you do need to take that seriously, but get some help, look up some of those online resources, how to figure out, if this is a genuine threat or not, because it is, we've seen case after case after case where kids were coached. You say that to get what you want.
Yeah. Even mental health professionals have encouraged children to do this to get what they want. So again, it is important to do an assessment, but again, to keep in mind that we don't give kids what they want because they threaten suicide. And if we have a generation of kids that learns that all that they have to do is threaten suicide to get what they want, we're going to be in so much trouble. Well, this has been a difficult topic. I really hope people will, do some research and really question when doctors say that, puberty blockers are reversible. Really think to yourself, does that even make sense? Does it make sense that a developmental delay would be reversible? Can that child go back in time and relive their childhood in a way if they decide they want to get off these puberty blockers? The other thing is that we didn't mention that I just want to mention quickly is that most kids who are on puberty blockers end up on cross-sex hormones. And I believe there's a reason for that. We see that a lot of distance happens during puberty. And these kids their puberty is being blocked. The very cure to their gender dysphoria is being blocked with puberty blockers. So they're much more inclined to go on cross-sex hormones than a child who has gender dysphoria who isn't put on blockers.
I love what you said there. Puberty is the cure for gender dysphoria in a lot of cases. Even WPATH, World Professional Association for Transgender Health, says, I believe it was 74 to 92%.
It's the vast majority.
Yeah, they will resolve their gender dysphoria and accept their birth sex if they pass through puberty naturally. That's the key.
Right.
Puberty is the cure for a lot of gender dysphoria in children.
And the right sex puberty, not puberty induced with cross-sex hormones. And that's
Right.
really important.
Yeah.
So what are we talking about next week?
Next week, we're going to tackle another difficult topic: when parents disagree. How to handle it if your co-parent does not agree with you on how to parent a child who's transgender identified.
That is a tough one. Well, we'll talk more next week.
We are not doctors or therapists. We are not giving medical or psychiatric advice, and we offer no guarantee of outcomes. We simply want to talk about how to support and love kids using long understood best practices from the fields of psychology, education, and child development. We're glad you joined in our conversation today, and we hope that you took away something you can put in your toolkit for parenting your gender-confused kids with truth and love.